Imagine you are sitting in a busy emergency room, right? A doctor walks in and tells you that you are suffering from a ruptured uterus.
Which is, I mean, an absolutely massive emergency.
Totally. But then, say, in a different room, another doctor tells a patient they just have a runny nose.
Right, a completely normal Tuesday.
Exactly. Or maybe someone else is told they need an immediate life-saving surgical repair. Well, what if I told you that in the medical dictionary, the difference between needing a tissue and needing an operating table comes down to a 2,500-year-old grammatical rule?
It just sounds completely absurd when you put it like that.
It really does, because when we think of medical terminology, we expect it to be, engineered for perfect clarity. You get a scan, the doctor points to a problem, and there is this unarguable Latin or Greek word for exactly what went wrong.
Right, because we build these systems on the assumption of precision. We're always aiming to, eliminate any possible ambiguity in patient care.
But then you step into this one very specific, notoriously frustrating corner of the medical dictionary, and that precision just vanishes.
It absolutely evaporates.
You are suddenly looking at a cluster of words that look identical on the page, sound identical if you say them fast enough, and they attach to the exact same body parts, yet they describe completely different clinical events. So welcome to the deep dive. Today, we are taking on a mission to decode a family of suffixes that haunts, honestly, every single pre-med and nursing student. We are looking at the Rrh family.
It is the absolute definition of diagnostic muddy waters.
Ooh.
We are talking about 4 specific suffixes today. So that's rrhea, rrhage, or rrhea, rrhaphy, and rrhexis.
They sound like someone just drew the worst possible letters in Scrabble.
They really do.
Yeah.
Just a handful of consonants.
Right. And I know you listening to this might be thinking, well, why do I need to care about a bunch of ancient, confusing medical suffixes? But as we have seen in our stack of medical linguistics and history sources today, mixing these up isn't just a matter of failing a vocabulary quiz.
No, not at all.
We are going to break down their definitions, trace their origins, and uncover why modern medical boards are actively trying to retire some of them right now.
Because the stakes are surprisingly high. And to understand why these words even exist, we have to travel quite far back in time. None of these 4 suffixes were invented by a single modern scientist in a lab.
Right, they weren't just made up yesterday.
Exactly. They were inherited directly from classical Greek.
Okay, let's unpack this, because before we even get into what these 4 words actually mean, we have to address the spelling.
Oh, the spelling is infamous.
Why are they spelled so terribly? 2 R's and an H. It's impossible to type on the first try, and honestly, it looks like a typo.
You can blame a phonetic marker from ancient Greek known as rough breathing.
Rough breathing.
Yeah. So all 4 of these suffixes trace back to a single Greek verb, which is rain. That's spelled R-H-E-I-N, and it simply means to flow.
Mm-hmm.
In ancient Greek, when a word started with the letter rho, which is their equivalent of our letter R, it often carried this rough breathing mark to indicate how it was pronounced.
So when that was brought into English, we just kept the marker.
We transliterated it. That rough breathing rho became the RH we see in everyday words, like rhythm, rhetoric, or rhinoceros.
Oh, right. I never thought about rhinoceros having that same start.
Yeah, it's everywhere. But here is the specific grammatical catch that creates that terrible double R. When ancient Greek grammar glues a prefix that ends in a vowel onto a word that starts with a rough breathing rho, the rho doubles.
So it sounds almost like a chemical reaction. You introduce a new element, and to stabilize the bond, an extra atom is just forced to appear.
I love that.
Like snapping 2 repelling magnets together, something has to shift to make them connect.
That is a brilliant way to visualize it. Take the prefix dia, right, which means through. It ends in the vowel A.
Mm-hmm.
Glue it to the root rain, starting with that rough breathing rho. The phonetic rule kicks in, the rho doubles to stabilize that linguistic bond, and you get diarrhea.
Wow.
Spelled with the double R followed by an H.
Meaning that when people misspell diarrhea with 1 R, they aren't actually being careless. They just haven't been briefed on a millennium-old Greek pronunciation rule that English swallowed whole.
Exactly. The linguistic fossilization is deeply embedded in our everyday language. It is a grammatical quirk from a language that hasn't been spoken that way in over 1,000 years.
That is wild. But it brings up a broader question about our sources. Why was ancient Greek medicine so obsessed with the concept of flowing in the first place?
That's the real key to all of this.
It just seems strange to build an entire medical vocabulary around that one specific verb.
Well, to understand the obsession with flow, we have to look at Hippocrates and his school, around the 5th and 4th centuries BCE. They lacked microscopes, obviously.
Right, no modern tech.
So they could only observe what the body expelled. Greek medicine was entirely built on humoral theory. The belief was that human health was fundamentally just a delicate balance of 4 flowing fluids or humors: blood, phlegm, black bile, and yellow bile.
So if you got sick, the assumption was just that one of those 4 fluids was flowing in the wrong direction or pooling where it shouldn't be.
Precisely. Disease was quite literally defined as a morbid flux. When a humor flowed into a joint and caused swelling or pain, they called it a rheuma,
Wait.
derived directly from that same rain root.
So wait, if I follow that logic, is that where rheumatism comes from? And rheumatoid arthritis?
It is.
Yeah.
When you say someone has rheumatoid arthritis, you are preserving the ancient, completely scientifically debunked idea that their joint pain is caused by rogue humors literally flowing into their joints.
That is mind-blowing.
It's fascinating. And later on, Galen, who was a wildly influential physician to Roman emperors in the 2nd century CE, he extended this flow vocabulary to name dozens of specific diseases.
But if I'm looking at the timeline in our sources, ancient doctors weren't teaching these 4 specific suffixes as a neat little matching set to their students, right?
No. The modern packaging is actually a late 19th and early 20th century invention. As medicine advanced rapidly, the global vocabulary was becoming unmanageable. There were just too many words.
Everyone making up their own term.
Exactly. So systems like the Nomina Anatomica in 1895 attempted to standardize things. Educators realized that if they taught students a word-building method like memorize a few key roots and suffixes, students could decode thousands of complex terms without memorizing each one individually.
Which brings us to the core 4. Let's actually decode this alphabet soup and separate the meanings, starting with the most basic one. That's rrhea.
Right, so the suffix rrhea simply means flow or discharge. And what's crucial to understand here is that it is etymologically neutral.
Meaning it's not inherently a bad thing.
Exactly. It does not inherently mean something is pathological or abnormal. Menstrual flow, everyday sweat, normal mucus, they can all be accurately described with the rrhea roots. Combine it with a body part, and you get a massive everyday vocabulary.
Like rhinorrhea.
Yes. Rhinorrhea is the medical word for nasal discharge, or just a runny nose. Seborrhea is an excess of oily sebum discharge, which is actually the root cause of dandruff.
So it's just the baseline function of the body moving fluids around.
Usually. But clinical context changes everything. Take otorrhea, which means drainage from the ear. It could just be a standard middle ear infection.
Which is no big deal.
Right. But if a patient has just suffered major head trauma, otorrhea becomes a massive red flag. It can indicate a cerebrospinal fluid leak.
Oh, wow.
Yeah, meaning the protective fluid surrounding the brain is actively leaking out of the ear canal.
That is a terrifying shift in context. But speaking of context, I want to bring up what might be the most bizarre historical detail in our sources. The medical mistake behind the word gonorrhea.
Ah, yes. Galen's great error. It is a fascinating case study in how vocabulary outlives science.
So Galen coined the term in the 2nd century CE by combining gonos, meaning seed or semen, with rrhea, meaning flow. He named it that because, based on the ancient understanding of reproductive anatomy, he mistakenly believed the discharge seen in infected patients was an involuntary leakage of semen.
Right, because ancient anatomy didn't differentiate well between infectious glandular discharge and actual reproductive fluids.
But Albert Neisser discovered the actual bacterial cause in the late 1870s.
He did.
The discharge is pus, it's not semen. The disease is a bacterial infection that has absolutely nothing to do with the flow of reproductive seed. Yet, the scientifically inaccurate 1800-year-old name just stuck. We know it's wrong, but we never bothered to change it.
It perfectly illustrates how rigid medical terminology can be. Once it's in the books, it stays. But let's move to the second suffix, which is rrhage, or its longer form, rrhagia. If rrhea is a neutral flow, rrhage is an abnormal, sudden, bursting flow.
Okay, I want to push back on this for a second because I think there is a major misconception here. When most people hear the word hemorrhage, they immediately think of blood.
Sure, of course they do.
If rrhage just means bursting flow, isn't saying hemo and rrhage together redundant? It sounds like saying blood bleeding.
I can definitely see why you would deduce that, but no, it isn't redundant at all. The suffix rrhage strictly means a bursting forth. It has zero intrinsic connection to blood.
It doesn't, like none at all.
None inherently. The specificity of the blood comes entirely from the hemo prefix. Or it comes from the clinical context, like menorrhagia, which refers to abnormally heavy menstrual bleeding. So hemorrhage literally translates to bursting blood flow. The suffix itself is just the mechanic of the burst.
That completely changes how you read the word. Okay, so rrhage is the sudden bursting flow. What about rrhexis?
This is where the confusion usually peaks for students.
I can imagine.
The suffix rrhexis means rupture. It is the structural fill word like the physical tearing event itself. It is completely independent of whether any fluid actually flows afterward.
So it's just the structural break.
Yes. For example, metrorrhexis is a uterine rupture. This is a catastrophic obstetric emergency where the muscular wall of the uterus actually tears open. Or on a microscopic level, consider karyorrhexis.
I saw that in the notes. What exactly are we looking at there?
When a cell undergoes necrosis, or cell death, one of the classic stages is that its nucleus physically breaks apart. Pathologists look for this under a microscope as physical evidence of cell death. It doesn't just quietly dissolve the nucleus splinters into scattered fragments, almost like a microscopic firework exploding.
Oh, wow.
Yeah, that physical fragmentation is karyorrhexis, the nucleus rupturing.
Okay. If karyorrhexis is the nucleus rupturing.
Okay, if rrhexis is the structural break, why are those two so incredibly easy to confuse?
Well, largely because they're etymological siblings.
Oh, really? Most people assume these four suffixes are just random linguistic cousins. But rrhage and rrhexis both descend directly from the exact same Greek root verb, which is rrhigni. That means to break or burst forth. Over centuries of use, they specialized in different directions. Rrhage evolved to describe the fluid flow that results from a burst, while rrhexis evolved to describe the structural tear itself.
It makes total sense that they cause confusion. I mean, they literally share a parent word.
Exactly.
Okay, that leaves us with the odd one out. The final one is rrhaphy.
The outlier. Yeah, rrhaphy has no connotation of flow, bursting, or rupturing whatsoever. It simply means surgical suturing or repair by stitching.
Okay.
So a herniorrhaphy is the surgical repair of a hernia by suturing tissue closed. A turniorrhaphy is the process of sewing a severed tendon back together, like repairing a torn Achilles.
So what does this all mean? Let me see if I can synthesize this for everyone listening. If I treat this like a plumbing problem in a house, let's say a pipe freezes in the winter.
Okay, I am always a fan of a solid mechanical analogy. Walk us through it.
If I'm understanding the sequence correctly, rrhexis is the actual physical copper pipe cracking open under the ice.
Right.
Then rrhea is the high-pressure water aggressively blasting out of that crack once the ice melts.
Perfect.
Then rrhage is the emergency plumber coming in and mechanically stitching or patching the pipe closed. And rrhea is just the normal, everyday water flowing out of your kitchen faucet to fill a glass.
What's fascinating here is that you've not only captured the distinct definitions, but you've perfectly aligned the clinical sequence. You have the physical rupture, the resulting bursting flow, the surgical repair, and the baseline normal flow. It is absolutely the most effective way to keep them straight in your head.
Here's where it gets really interesting, though. The plumbing analogy works perfectly in a textbook. But when these subjective ancient words hit modern data-driven medicine, the whole system just starts to buckle.
It does. And this raises an important question about the evolution of medical measurement. We are currently watching clinical governing bodies actively try to retire some of these ancient words because they have fundamentally outlived their clinical usefulness.
Because if a suffix like rrhage just means bursting flow, who decides what constitutes a burst? That sounds incredibly subjective, which seems like a nightmare for modern medical research or, billing. Is that what happened with the menorrhagia debate?
You've hit on the exact reason the terminology had to change. For decades, terms like menorrhagia, meaning abnormal or heavy uterine bleeding, were standard vocabulary. But the ancient suffix was simply too vague. One doctor's visual definition of menorrhagia was entirely different from another doctor's.
Oh, I see.
There was just no agreed-upon quantitative threshold for what constituted the rrhage.
So if you are a researcher trying to compare treatment outcomes across 50 different hospitals, your data is completely useless because everyone is using the same word to describe entirely different severities.
Exactly. The data becomes hopelessly skewed. To solve this, the International Federation of Gynecology and Obstetrics, known as FIGO, deliberately decided to phase out the rrhea terminology. They introduced a highly specific, standardized classification system called PALM-CQ-EAN.
I saw that acronym in the research. How does that system actually fix the subjectivity problem?
It forces doctors to diagnose the exact mechanism of the bleeding rather than just labeling the flow.
Rum.
Paul M covers the structural causes. So that's polyps, adenomyosis, leiomyoma, and malignancy.
Okay, that makes sense.
And then Cole Adiine covers the non-structural causes: coagulopathy, ovulatory dysfunction, endometrial issues, iatrogenic causes, meaning caused by medical treatment, and not otherwise classified.
Wow, much more precise.
Right. By using this system and pairing it with plain descriptive language like heavy menstrual bleeding, doctors communicate precisely what is happening and why.
They took a 2,000-year-old word and just retired it because the modern understanding of gynecology requires a level of mechanical precision that ancient Greek just can't provide.
Yeah.
And we see this exact same realization happening in obstetrics, where the stakes are quite literally life or death, right?
Postpartum hemorrhage is a prime example. It remains a leading cause of maternal death worldwide. And for a very long time, the definition of a hemorrhage relied on a clinician's visual estimation of blood loss.
Visual estimation.
Yeah. The threshold was typically 500 milliliters for a vaginal delivery or 1,000 milliliters for a cesarean.
But if visual estimation is notoriously subjective, how do you accurately measure the volume of blood lost in the middle of a chaotic delivery room? That seems impossible.
Well, that was the fatal flaw of the old system. Visual estimation leads to chronic, dangerous underestimation. Today, modern hospitals have shifted to something called QBL, or quantitative blood loss.
So they actually measure it.
Instead of guessing, care teams actually weigh the blood-soaked sponges and surgical drapes. They subtract the known dry weight of those materials to calculate the exact milliliter of blood loss.
Because redefining what exactly crosses the line into a rrhage dictates exactly when a care team activates a massive transfusion protocol. If the word is vague, the emergency response is delayed.
Exactly. The definition carries immense triage weight. And we see a similar vocabulary shift happening in surgery, specifically regarding the suffix orography. The transition away from the herniorrhaphy is like a masterclass in how technology forces language to adapt.
This is the Bassini method, right?
Yes, it is. For most of the 20th century, if you suffered a hernia, you received a herniorrhaphy. In the strict sense of the suffix, this meant that the surgeon pulled your native muscle and fascia together and sutured it tightly closed under tension.
Just pulling it tight.
Right. This approach, pioneered by Edoardo Bassini in the 1880s, was the gold standard.
But wait, if you pull native tissue tightly together with stitches, you are putting it under immense mechanical tension. Doesn't that restrict blood flow to the tissue that's trying to heal?
You've diagnosed the exact flaw that plagued the procedure for a century. Tissue ischemia, which is a lack of blood flow combined with mechanical tension, causes the tissue to weaken and tear all over again.
Oh, so it just re-ruptures.
Recurrence rates were a massive problem.
Yeah.
So in the 1980s, surgeons like Irving Lichtenstein popularized a tension-free repair. Instead of suturing the torn edges together, they placed a piece of synthetic mesh over the defect.
Like putting a screen patch over a hole in a window screen rather than trying to pull the broken wires together.
Precisely. The mesh distributes the tension across a wide area, allowing the body to grow new tissue into the mesh without straining the original defect.
Yeah.
But linguistically, they were no longer simply suturing tissue together.
So it wasn't a rrhaphy anymore.
Exactly.
Yeah.
It shifted from a chirurgraphy, a simple stitching, to a hernioplasty, a reshaping or structural reconstruction. The words literally track the evolution of surgical technology. The chirurgraphy approach wasn't wrong for its time, but as material science improved with synthetic mesh, the suffix had to change to match the mechanical reality of the new procedure.
It is incredible how the history of technological progress is baked directly into the suffixes we use.
It really is.
As we wrap up this deep dive, I want to give you, the listener, a quick, practical takeaway. Next time you are reading a medical chart or a health article and you stare down a terrifying 18-letter medical word, don't panic. Look at the end of it. Look for the suffix. Just remember the sequence. Something structurally ruptures. That's rrhexis. It bleeds or bursts under pressure. That's rrhexia. An emergency surgeon comes in with the needle and thread to sew it shut. That's rrhaphy. And rrhea is just your everyday baseline flow.
We connect this to the bigger picture. This isn't just about passing a pre-med terminology exam. Understanding these building blocks fundamentally empowers you as a patient.
Yeah, totally.
It lets you decode your own health records. It helps you understand global health initiatives regarding maternal mortality and hemorrhage protocols. It stops you from being overwhelmed by the barrier of jargon. You transition from memorizing isolated, intimidating words to actively deriving meaning and participating in your own care.
I love that. You become the translator of your own healthcare. But I want to leave you with one final, slightly provocative thought to chew on. Today, we learned that words like gonorrhea and rheumatism are basically fossilized monuments to ancient medical misunderstandings.
Huge misunderstandings.
They are 2,000-year-old Greek mistakes that we just never bothered to rename. It makes you wonder which of the highly technical, cutting-edge medical terms that doctors use with absolute confidence today will look like hilarious, completely misunderstood ancient relics to the doctors living 2,000 years from now. Keep questioning the dictionary, and we'll see you on the next deep dive.